Hello guys, it's chapter 4, part D. Today's topic, second stage of labor. Let's see the management of second stage of labor. And the second stage is from full dilation of the cervix to the fetal birth. That is, when the cervix starts to open up, when the baby is trying to come out from there to till the childbirth. This is second stage. In this stage, the child is born. Okay. In this stage, if you see the premigravida, that is the woman is going to give the first delivery. When the woman is going on the first delivery labor, the time is 1 hour. Whereas for multigravida, it is 30 minutes. Sorry, not hours, 30 minutes. Duration is, for premigravida, it is 1 hour. For multigravida, it is 30 minutes. Sign and symptoms. In this, these three are very important. The first one is uterine action. Uterine action is nothing but, here you can see descent. Descent is the regular contraction and expansion, and the movement of baby is descent. The baby is trying to come out. Because of that, there is even the rupture of membrane is found here. Maternal vital signs are seen like in the form of temperature, respiratory rate, and blood pressure. Temperature will be increased, respiratory rate will be decreased, and BP will be increased. And vaginal signs, that is nothing but opening and pain. That is nothing but when the baby is trying to come out, the vagina will be widening, and there will be pain. If the baby is not able to come out, we will even perform the episiotomy, which is also a opening and a painful process. These are the signs and symptoms. Conduct of delivery. Conduct of delivery is nothing but why we are conducting these deliveries with following so many protocols, like we need to maintain the sanitizing measures, we need to provide emotional support, we are recording that partogram. Why we are performing so much things? It's because the principle is, it's because we have to perform the natural delivery. That is, we are trying to reduce the C-sections, and we are trying to increase the rate of slow and steady natural deliveries, and even we are trying to decrease the perineal injuries and infections. This is the main cause to perform the delivery in so many standard ways. And the main thing is the preparation. That is, at the time of delivery, the woman is given the lithotomy position, and the bladder is full. We will provide catheterization, and everything should be followed in a sanitized way. Please do Google what is lithotomy position. If you know it, it's very good. Lithotomy position is the position in which the woman's labor is conducted. It is important. Okay. Neonatal resuscitation. Neonatal resuscitation is nothing but the cleaning the airway. You have been observed that after the birth of the baby, the doctor usually holds the baby in the upside down position, because when the baby is present in the womb, it doesn't breathe. Its lungs will not be functionable. After the birth, we need to make sure the baby's lungs is functioning. So neonatal resuscitation is done. Okay, that is nothing but clearing the airway. And the health condition of baby after the birth is generally checked by Apgar score. And in this Apgar score, if the score is between 7 to 10, then the baby is absolutely normal, or maybe some kind of minimal small depression in the sense small defect, it is seen. If the score is between 4 to 6, it's in the moderate condition, we need to take action immediately. If the score is between 0 to 3, then the baby is severely ill, we need to take care, and there is a chance of being the illness to be continued lifelong. This is Apgar. A for appearance, P for pulse, G for grim, A for activity, R for respiration. Based on the result, you are going to give the marks. Like for the appearance, if you see the baby is blue in the whole body, then you need to give the 0 marks. If the baby's body is pink and the extremities, that is leg and hands, are in blue color, then you need to give 1 mark. If the baby is whole pink color healthy, then you need to give the 2 marks. On the whole calculation, if you get 7 to 10, then the baby is healthy. Okay. Next, pulse. If you can't detect the pulse, then you have to consider it as absent, that is 0 marks. And then if it is below 100, then it is 1. If it is above 100, then you have to mark it as 2. Next, grims. It is nothing but reflex in the sense reacting. If the baby is not reacting, it's very quiet, then it is floppy, that is 0. If the baby is reacting but not active, it is reacting very slowly, then it is 1. If the baby is very active, then you can give us 2 marks for it. Next here, muscle tone. Muscle tone in the sense how the baby is shaking its hand, whether it is feeling strong to move its hand or not, or strong to move its leg or not, like that. First it is absent in the sense you have to take it as 0. Next it is 1, that's it can flex it hand and leg. It is able to move but it is not active, just a moderate way. Next, last one is active in the sense it is moving its hand vigorously, that is it's very active. Generally the baby be active, no? That way. Next, respiration. If it is absent, then you will be placing the baby in the ventilators. Next, if the baby has slow and irregular, still the baby will be in the ventilators. Next, generally if the baby is crying vigorously, then you have to give it 2 marks. And even in this condition, the baby is in ventilator, because soon after the birth, the baby will be placed under the oxygen mask. So generally the baby will be placed in the ventilator. So on calculating all these marks, if you get 7 to 10, then the baby is in normal condition. There are few steps we need to be followed by the nurse during the resuscitation. That is, we need to receive the baby in a pre-warmed towel. At the time of delivery, that is, we will come to know, we need to warm the towel before itself. Next, place the baby in the backwards, that is the position of the baby. We need to lay it down in the back and the neck should be slightly extended. Okay. And then suction is performed. Suction should be done in both mouth and nose to avoid aspiration, to avoid further problems. And this suction should be done around the pressure of 80 mmHg. And this is very important. The free flow oxygen is provided to the baby. That is, the baby is kept like this, and around we will see a basket like thing, a bowl like thing will be placed around this baby's head, and the oxygen wire is connected to it. In that way, the oxygen goes to the baby and the baby inhales oxygen rich air. Episiotomy. Episiotomy is nothing but the incision in the perineal area. Perineal area, that is, imagine this is as anus and this is vagina. If the baby is not able to come out, then we will cut here. And this cut is known as episiotomy. The cut between the vagina and the anus, that is known as episiotomy. Why we perform this episiotomy? To prevent the damage in pelvic floor, pelvic muscles. If premature baby is about to delivery, the baby itself cannot come out. So we will promote the delivery process by cutting here. And if the baby has any conditions like shoulder dystocia, if the baby's shoulder is injured or if there any defect in the shoulder, then we will promote the delivery process by this method. And malposition, baby is in the wrong position. Fetal distress in the sense fetal is not receiving enough amount of oxygen inside the womb, so we need to take the baby as soon as possible. And if the child has large head, then the baby can't come out, then we will perform this episiotomy. By performing episiotomy, what are the benefits? Okay, first, for mother, if you see in the mother case, the episiotomy cut is easy to repair. It will heal very fastly and the structure will be protected. That in the sense, in normal delivery, normally there is a chance of lowering the uterine structure. The uterine structure never comes down in this condition. If we perform episiotomy, the uterine structure never comes down. And second stage of labor will be shortened, will be completed in very small period of time, and the tears, unwanted tears, will be avoided. This is in the point of view of mother. When we see in the point of child, the birth will be very easy and if any damages can be prevented, mainly brain damage. These are the benefits of episiotomy. And this episiotomy can be performed in 2 ways. That is median and mediolateral. In the name itself you can understand. Let me explain it in proper way. This is anus and this is vagina. Okay. This is the midline. If we cut in this straight midline, this method is known as median. It is straight. Okay. If we cut in the straight line, it is median. And the second is mediolateral. In mediolateral method, We will take the incision in 45 degree from this midline. From the midline we will take 45 degree cut, and this cut is known as medial lateral. This method is called as median. This method is called as medial lateral. Questions will be provided at the end of the chapter. Until then, stay tuned. Meet you in the next video. Bye.